Recording in progress. For those of you guys on Zoom, if you will please sign in the chat so Jennifer can get your name in the Wheel of Fortune for the $25 gift card. And we'll start here in 3 minutes. Can you guys hear me on the Zoom world? All right, thank you, Evangelist. Hey, Mary.
Are you?
Here, my mouth, now I'm like. Shoulder. You can travel. No, but. Sometimes I around here. All right, it is now 12 o'clock. We can go ahead and start. If everybody in the room, please make sure you sign in at the front. If you're a member, your name is printed on a sheet. If you are a guest, you'll have to give me all your information. If you're a new member, I don't have you transferred over yet. So welcome to the June membership health council meeting. Now 12:01. Are you? In the packet on the backside of the agenda is the minutes from last month. You can look at it. Nope, sorry, it's not on the back. It's the second page. It's been a couple days since I printed this. Did anybody have any changes that needed to be made? All right, being none, we'll go back to the agenda. Behavioral health and wellness. Update.
We've given the same update because there's 4 meetings we have from this. The last behavioral health meeting that we had was to focus on what the health council can do moving forward with our different committees and what kind of funding that we can look at bringing in. So I believe, correct me, make any mistakes on this. So since we've been focusing tremendously over the last 2 years on the county health improvement plan that's focused on preventing gun-related deaths and suicides. And so we focused on gun locks, awareness, and campaigns like that. We'll continue moving forward with that. And a lot of that will move over into the Together with Veterans group, and because they have funding for those kind of things. And then our group will continue working with the LC5, which is the collaborative of Eddy and Lee counties along with Chaves County for the Senate Bill 3 funding for behavioral health and substance abuse treatment, and fill in any gaps have that.
That's pretty much it. And then we're gonna focus on the navigations and the 211.
Right. The idea is that the LC5 collaborative has put forward one of the priorities being navigation services. And so Carrie's been working on the 211s in both Lee County and Eddy County, along with Chaves County, that Carrie with Health Council runs, so that there is a true collaboration between those 3 counties of resources and services and to train us such.
Does anybody have any questions about behavioral health? All right, thank you, Dan Jennings.
Right on time.
All right, update for Together with Veterans. Danny.
Hello.
Hello.
Sorry, there's an echo. So okay, I'm just gonna go. We have a stand down on October 16th. That has been set. We have a planning meeting on June 20th at the American Legion. And that meeting, we will be able to start working with the team to start getting some ideas going for sponsorships, food, and things like that. I believe it's at 11:30. Is that correct, Jen?
Yes.
Thank you. And I have the wrong notebook in front of me, so. And then we'll be supporting the Chaves County Health Expo in August, and then just continuing in sustainability.
Does everybody know what the stand down is? All right, so this will be our second one for that. It'll be at Pioneer Plaza again on October 16th, which is a Friday.
And we also have a QPR training coming up in September.
Have you heard back from the city on the permit? I have not. Oh, thank you. All right, Health Expo. So our next Health Expo planning meeting is June 22nd. I should have all the flyers, fingers crossed, in my hands to hand out so that those can get spread across town. The expo is August 1st. All the sponsorship deadlines have come and gone. This is old. When I put this in, we had 21 sponsors. We have a couple more now. I'm not gonna turn down sponsorships. If anybody wants to do it, just, I can't put your logo and stuff because it's too late at this point. If I've sent you an email saying, hey, I have to have your stuff by Friday. I need your stuff by Friday, otherwise it's too late and you don't get put in there. But we're looking good. It was 81 booths, but again, I've got a little bit more than that now, and I still have no confirmation from RSD on how many booths they need. So hopefully I'll get more from them and we'll get that filled out. There are booth forms here. You can do booths up until June 21st or 22nd. I believe it's like right at the same time as our next meeting is the deadline. And then after that, you have to beg and plead for me to put you in because it takes a lot for this all to process, to put together.
And you also get charged $100 late fee. So it'll be 175 per booth instead of 75. It's a kind of an inconvenience fee for Carrie. But it goes into the expo and what we pay for.
And I know it sounds awful, but we literally have some people who come in like 3 days before the event and want a booth and then get upset because they didn't get a spot they felt that they should have got. So it truly is an inconvenience fee. Any questions on the expo? Seeing anything in the chat with that? We have a presentation from Lifehouse. How many of y'all are here?
Hi, Carrie. I'm online, virtual.
Oh, okay. Okay, so we're gonna read. Okay, the green. Okay, Mara, you can share now if you need to share.
Awesome. I don't have anything to share because I thought I would be there in person. But we're getting things up and running here, and my dog sitter, I have to be here for my dog. I don't know if you can see, she's right behind me. So that's why I am remote. But hi, everyone. My name is Mara Schoenfeld. First, I'll just give a little background on myself, then on Lifehouse, and then on CCBHC. And please feel free to stop me, raise your hand, interrupt me. Just because I don't want it to be a lecture. I want it to be where you all are, we're just having a conversation, because I feel like you, or at least I, definitely get a lot more when I'm involved in the conversation rather than someone just kind of talking at me. But again, my name is Mara, and I am originally from Gallup, New Mexico, and born and raised there, lived there. I went to school at UNM. I have a master's in public administration and policy. I have been doing this work adjacent with domestic violence, sexual assault, nonprofits. I was the DWI program manager for McKinley County years ago, and my last position was with Santa Fe Recovery Center. And there I wore many hats. I did operations. I oversaw 5 different grants, federal grants and state grants, and then was the inpatient and detox director as well. In February, I transitioned over to Lifehouse Carlsbad and became a regional director with them, with the idea that I would actually be in Silver City and doing those counties there. But such is life, things changed, and I am now on the other side. of New Mexico, which is really awesome. I'm excited to learn more about the communities. And for better or worse, I have talked with a lot of folks, and a lot of the feedback I received is very similar to what I know about Gallup and McKinley County and that area. So I'm hoping that I can bring some of that, although, you know, it's a little bit different. I worked directly with Navajo Nation, Zuni Pueblo, and we were about 20 minutes from Arizona. So I hear there's a lot similar with Texas, since we're so close, and with Arizona, we had a lot of folks there with that insurance. And that was always something tricky for us. So with Lifehouse, again, I'm new, but I'm learning a lot. So Lifehouse has been around for a while, but really in 2016 is kind of when our executive director started to do sober living. So he first started out kind of doing groups, outpatient groups with folks, and then I think saw the need to help more and to help fundraise and develop sober living in Carlsbad. And if you all ever get the chance to, and that this is part of our plan for Roswell as well, is to have sober living. It's phenomenal, the work that they've been able to do in Carlsbad with all the different sober living. So there's women's and children's sober living, and all of it was fundraised. So it's really, really awesome. And so I know feedback I've had in meetings with folks from Roswell, that is a big thing, having sober living homes. And so that's absolutely on our agenda to do. So Lifehouse started with sober livings, and then saw the need to take over an inpatient and detox in Carlsbad. And they've been doing that for several years. And last July took over a detox and outpatient in Taos. So now we have a Lifehouse in Taos, and now we have Lifehouse in Carlsbad. Taos is not a CCBHC, so Carlsbad and Roswell are CCBHCs, and what that is Certified Community Behavioral Health Clinics. Those are clinics, are a model that was started about 2014, 2015 through PAMA, which I didn't write down what that acronym is for. There's too many acronyms to really keep all of them in my brain. But it was definitely a federal movement to help provide direct and quick, easy access to care. So CCBHCs, Certified Community Behavioral Health Clinics, there's different components and several different requirements. And that can be some CCBHCs partner with folks who are maybe already doing those components, or they do them themselves. So there's actually 9 components, and that would be crisis, outpatient mental health and substance use services, person and family centered treatment planning, community-based mental health care for veterans, peer family support and counselor services, targeted care case management, outpatient primary care screening and monitoring, psychiatric rehabilitation services, and screening, diagnosis, and risk assessment. So those are a lot of words. And I won't necessarily go through all of them, but absolutely we can talk more about them like one-on-one. We will have more information now that we have our building location. We're working on pamphlets, we're working on signage. We're also working on a new website, because CCBHC is such a beast. For those that have been doing it for years, there's still more. And of course, it is Medicaid reimbursed. And as we know, those policies and laws change quite often. So it's a lot, but we did start our crisis, 24/7 crisis. That was started a few weeks ago. Some of you, I believe, may have spoken with our crisis director, or at least met them, and that's Dr. Jess. They're an expert. I mean, Dr. Jess is fantastic. And we have, I believe, 4 crisis responders now. We're working to have up to 9. And I do want to just reiterate, because I believe some folks were calling 988, and unfortunately, they're not connecting to us. So just call Carlsbad Lifehouse directly, please. And then you'll get crisis services. I think it's all just trial and error and learning, and the connections and communications, and we'll get there. But Roswell, Lifehouse Roswell is super new. So I think we're just like anything, we have some bumps in the road, but we'll get those fixed. And everyone's been really great. And I think I know we're happy to be here. And I've spoken with a lot of folks in Roswell who are also happy that we're here. So it's really exciting. And that's, of course, we want to be here to offer these different services and to get feedback on, what else, what are the other needs here and how do we help assist with that. As far as So the building is way down south, as I'm learning. We're right next to the airport. So it's 9 East Challenger Street. And I'll actually put it in the chat. It's been another one of our trial and errors. We're trying to find where our mail is, because a lot of folks don't know where we are. And it's been my understanding is that it's been a vacant building for quite some time. But that's where we are. We're actually right next to, in front of us or to the north of us is the Youth Challenge Academy. We share a parking with them, and then right behind us is a fire department. So we hope to, as I said, crisis services have already started. Let me also put in the chat the number, and I think it's on the agenda as well. Unless I'm totally fibbing, but I'll put it in the chat. Okay, I'll put it in the chat as well. The idea for us right now is that Carlsbad really will kind of remain the hub. So any of the Carlsbad phone numbers that you find, you call them, they will route you over to us in Roswell. We've started crisis service. Yeah.
You've already responded to for the last few weeks you guys have been open?
Say that again, Geneva, but
How many, do you have a number of how many crises you have responded to? You guys have had the 24/7 in Roswell?
I do actually. This was as of yesterday. Let me see.
I just kind of wanted to know about a time frame. Do you guys have on how quickly you want to respond to crisis? I just have a little bit of concern because one of the crises took 56 minutes to respond to, and these actually ended up responding. And that's what we're trying to avoid. So I was wanting to work with you guys on timing on how maybe we can work more quickly to get to the crisis. Yes.
Okay.
I don't know if Carlsbad has like a specific, we want to be on team or a certain time.
Okay, so I believe Dr. Jess has mentioned that it's probably, I want to say 10 to 20 minutes in Roswell, and then for the county, or maybe it was 10 to 15, and then the county is like 20 minutes for a response. but I will double check with Dr. Jess on that. And sorry, just want to write myself a note. Okay, and then you asked for how many folks we've seen. I know I got that yesterday. Sorry, was there a question?
No, we're just waiting on the numbers.
Okay. Okay, and I apologize. I'm having to go through a chat to find them. But I will make sure I get that number. Over to you all. I know that it's been quite a few, which is great, and we definitely want folks to be able to give us a call. I know that there was one incident that a different number was called and then it wasn't necessarily like routed. So definitely want to make sure that we just call the Carlsbad Lifehouse number directly, and then we can they'll route to the folks, the staff that are in Roswell. Like I said, we have 4 individuals right now. Dr. Jess is continuing to hire so that we could have 9 responders. And that we can, so right now we have mobile crisis, and we'd also like to have crisis receiving. So that's where folks can come into our location, and that would also be 24/7. So we're working up to that. We're also working up to all of the other components that I mentioned about CCBHC. So outpatient, we have therapists that have been hired. We have case managers that have been hired. We should be starting by the end, I would say by the end of this month, with individual counseling, and July to August, our IOP, intensive outpatient groups would be starting, and those will be in the evening. I don't know if there's any questions about IOP. It's about 9 hours a week, 3 hour, usually 3 hours for 3
Will that be
nights.
August?
So that probably, the plan is July, if not August, but we're really trying to get everything quick, as quick as we
Will that be
can.
At your location, on base, that's where those will be held, the IOPs.
Yes.
Will there be transportation, through bus services to and from?
Transportation, yes, we will definitely use the bus service. We have submitted an application to get vehicles for transportation. We've not yet heard back from that, but and if we don't get it through that, that is something that we're trying to get wherever the funding is so that we can help with transportation. But as of right now, we don't have that.
So veterans can ride the Roswell Transit for free. Together Veterans does have a grant in place with the Roswell Transit, so they could, if the bus route goes down there to the airport, I'm not 100% sure on the routes, but they do ride for free.
Awesome. That is another one of our components, is for veterans specifically, to have services for veterans, and of course anyone. So I think a big part of what I hear is, do they have to have a substance use disorder? And they do not. This is a behavioral health clinic. So if they do, of course, we will take them. Most folks that we see are dual diagnosis. If they don't have substance use disorder, that's fine. If it's, they're having some mental health challenges or behavioral health challenges, that's where we come in, and we want to make sure that we can get them to the appropriate services. And then we are also the lifespan. So really it's they, if they want to keep coming and are, open to us continuing to serve them, that's what we're going to do. It's all, we're really following the individual's lead. So if they no longer want us, then we will say, that's fine. We'll respect them on that. The plan also within a year or so is to do youth. So CCBHC, another requirement for that is for youth, to have youth services, youth intensive outpatient programming, and such like that. So that will hopefully be a year or two. Right now, we're ramping up more of the adult components. And I'll kind of just leave it for questions.
Another question. Do you see your crisis response team ever doing street outreach, or will this all be referral based? Meaning, a lot of folks on Main Street, Roswell, that have businesses, have a consistent complaint about the visual of homelessness. And homelessness is, in some cases, is a crisis. So will your crisis response team be doing any street outreach, or is it all referral? A phone, someone has to initiate the phone call to go out.
That's a good question. I would say that probably they do. In Carlsbad, I know that they have somewhat in Roswell, but we only had 2 folks on staff at that point. So I think once we're at 9 people, that will help us a little bit more to be able to do street outreach. Sometimes they like to go, I know they've wanted, like Dr. Jess has wanted and has gone to like the sheriff in Eddy County specifically, to the hospital. So things like that. And then also to, I guess, like high traffic areas. And then I think along with staffing the CCBHC in general, we will also have folks that will be able to assist in some way in doing that. We don't have anything, the CCBHC doesn't have anything specifically. And I would say Lifehouse also, we have like a community education specialist. We don't have the position titled street outreach, but that's certainly something that we do in different capacities and different positions. I know that Dr. Jess and I talked about working with the Pecos Valley emergency responders. I don't remember actually so we wanted to meet with them. I know that Michaela had a lot of great feedback. And so Dr. Jess and I really wanted to make sure that we're all working on the same team and seeing what they're seeing, because they have been doing, this for years and have, I think, great insight into that. And so if we can just, it's not us coming in and now we're going to do all of this. Like we are here to be part of the community and to help and support and assist. And I think if there's something that's like, another agency, is doing that and has been doing a great job, awesome. Let's partner with them or just stand back and be referred to.
Thank you.
Cecilia?
Yes. I really don't have a question, but I wanted to let you know that the Department of Health used to be at that number 9 East Challenger Street. And just to kind of help you on a pamphlet or something that you hand out, when you Google map that, it'll send you to the back of the building. Right there in front of the fire department, to like that shipping area that's in the back, or where you guys park in the back parking lot. So I would just to make it easier for you or any clients that come to get IOP, that might be helpful for you to have on a flyer. So I just wanted to help out there.
Yeah, awesome. We have had lots of challenges with that. So we do have a communications person who's going to try to change the pin to be like in the front where the front door is, um, with the Google profile or whatever. So actually checked in with her today because we're uh looking for items that we ordered and we're wondering where they went. So yeah, and I know even some of the staff that we've hired had some trouble. I'm learning that this is not like a part of this is way south of town, and so a lot of folks are like, okay, I live way up there actually, and so it's going to be interesting. But we're definitely working on signage and the Google profile, and also just making it look and feel very comfortable and welcoming. And it's partially a metal building and partially a brick building, cinder block, not brick, cinder block building. So we're definitely trying to paint and just add things so that folks, whether it's our partners or it's individuals in the community, that they can come in and feel like, okay, this is where I'm safe and I can get support here. So thank you, Celia. I appreciate that.
You're welcome.
On your crisis response, using the Carlsbad number, is that answered 24/7?
Yes. So we have dispatch.
So what's the number to call here in Rossville? I know you put it in the chat, but I can't see the chat. What is it?
So our dispatch is actually all centered in Carlsbad. So it'll be the same number wherever you are, and that's 575-725-5552.
And then, adolescents, do you do crisis response for adolescents? What's the
We
age?
are so we don't yet do it for adolescents. We are still in the process of working with the state to get the certification. And it's just been a process. So we are working on it. We absolutely want to do it. And Dr. Jess has been in several meetings, but I don't have any updates. And I don't know the age off the top of my head.
Sonia?
I think you're gonna wait. By the way, you guys speak very loudly. Can you hear me?
Yes.
Okay. So your dispatch, how do they pass the calls out? Like, let's just say, for example, we call and we have a crisis with an individual that's also obviously having a mental health breakdown. And we call them, we give them the information and everything. Are they the ones who are gonna determine, yeah, we can send somebody out there, or sorry, we can't help you? There's nothing we can do for you. Pretty much.
No, so dispatch, I mean, of course, dispatch is trained, but they are not the crisis responders. So they should not be making those calls. That would be for crisis. And I don't believe our crisis would, there's not like a checklist where the crisis responder is like, they don't really need us, I don't want to be totally blasé about that, but we're going to go to any crisis. There's not it's not as important as this or whatever, so definitely if anyone does have that happen when they're talking with dispatch, that would be great for myself and Dr. Jess to know, because that's not, they're going to go and they're going to make sure that they see what's happening. And maybe I could see maybe it's like, oh, this person actually really cut themselves and hurt themselves, and that's not what crisis. They'll do first aid. They can bandage, something, but if it's like medical, then they will call in someone who is the expert in medical. Otherwise, I mean, they're going to show up.
So what's the process? So somebody's having a crisis, you're called, the team is dispatched, they talk to them, and let's say they're having a conversation with them. They decide that they need help. They've got to go somewhere, do something. It's more than just a conversation. What's the next step? Where do they go?
So crisis, it'll kind of depend on also what if it's something with medical, they're going to get them there wherever the appropriate service is. And I know sometimes we don't have the appropriate service. And so what they're going to do is, let's say it's someone who the crisis is related to substance use disorder. Then we're going to talk about, here are the services we have for detox or inpatient or outpatient. We also have an ACT team. And the ACT team is assertive community team. The requirements there are pretty narrow. They do have to have like a mental health diagnosis, and then they're watched, and it's, very intense. Some of our folks in crisis may fit those guidelines, and so then they would become part of the ACT team. Sometimes, I know that it's really difficult. We have, I think, everywhere, not just this state, but, everywhere, trying to get somebody into a mental health facility. So I know that Dr. Jess is very aware of that. I know that if needed, that's where, they're going to refer that individual to. But I think mostly a lot of it is just checking in with them and working through the crisis, and then making sure that they have case management. If we do have them go to outpatient or any of our other services, or if it's an outside service, then we're going to make sure that we follow up with them and provide that continuum of care with them. And then, of course, all the things like tools for when someone is in crisis. I know we have some folks who, anxiety, depression. So providing them with the tools to help in that case, but also the long-term resources with that.
So non-medical, so are you like working to get them into the New Mexico Rehab Center or Sunrise? Are they going down to Carlsbad, to Hobbs? I mean, we don't have, since Roswell doesn't have a detox place, we don't really have a place for that. So if they are needing assistance that's not the emergency room, what's the process?
Yeah, then we, of course, consent from them, but the CCBHC detox and residential aren't part of CCBHC. So for Roswell, our location, we won't have detox or inpatient. So any of those folks will go to, obviously we'll give them an option of, you want to go to Albuquerque, you want to go to any of one of these, even our Taos, we have detox and outpatient in Taos. But for the majority, we'll refer them to Carlsbad, to our detox and inpatient in Carlsbad. And then, of course, Sunrise, Mesilla Valley, if that's appropriate.
Not in the right mind, obviously, to tell you that they want to go. What do you do? Because they're having a breakdown, so they can't make that decision to say, yes, I want to go get help, because they're lost, they're having a breakdown. What do you do with those type of clients?
That's what, yeah, the crisis responders are trained in, we're not going to ask them those kind of questions when they're in the midst of the crisis. As far as, you know, if sometimes they aren't even able to talk, they can't even speak to you because they are, you know, in a crisis. And so sometimes those decisions are not made within even that hour. So our crisis actually, I mean, they can be with this person for 30 minutes to hours, to ensure that that person is safe and there is a next step with them. That's a big part of why we want to have the crisis receiving here. Folks can stay here up to 23 hours, and that's according to, you know, NUMAC and all of that, those things. But that's what the crisis responders are trained and prepared for, to make sure that, you know, we're following that individual's lead, but also we have to make sure that, you know, that person is safe and others are safe as well. I can't give you like an exact or direct because I'm not crisis, but these are questions that I will forward to Dr. Jess, and probably it might be a good idea if next month Dr. Jess is here and can answer those questions better than I can.
Dr. Jess again. Dr. Jess.
Who is Dr. Jess?
Yes,
Sorry.
that's the question. That was the question. Who is Dr. Jeff?
Dr. Jess is the crisis director.
Where is he from?
Her.
Or her? Where are they from?
They, Dr. Jess is they, them. They are from Las Cruces.
What kind of doctors are they?
Oh my gosh. Dr. Jess is, that's such a good question. I think social work, LSAA, and they have several credentials, but they are an expert in crisis and pretty awesome. They are actually out right now on vacation, much needed vacation, but always open and happy to have conversations. This is their passion for sure.
Your crisis receiving, that's for 23 hours. I recently was in Albuquerque earlier this week and got to see a crisis receiving, and they also were doing detoxing. So like for alcohol detoxing, if someone was picked up, intoxicated, they could go there. Is that what the receiving is going to look like?
It'll definitely be similar, except for that we don't have a detox in Roswell.
So where will they go?
To the detention center? Yeah, that's where they're taking them out.
If someone needs to detox,
If they're picked up for being intoxicated, instead of taking them to a detention center, they would take them to this receiving center at the Gateway Center. And so I was wondering if that's how it would be set up, and if not, would it just be continually going to the detention center or the hospital and not the receiving center?
it probably will depend. And I would say that we would probably take them to Carlsbad so that they could be at our medically monitored detox. Now, let's say it's someone who, I know for alcohol use, you know, that's a little bit different, but with substance use, they would be able to come here once we have the crisis receiving. And I mean, even if they don't want to detox, you know, they don't necessarily have to detox. I just know that, like, of course, there's, you know, things in the community that they want to move those people away or out of sight. For us, obviously, like absolutely they can come here, and if they don't want to detox, at least they can be warm and have food and hang out for a while, and then we can talk to them about next steps. And they may want detox, or they may want inpatient or outpatient. They may want nothing at all. And that's totally fine. And we'll just work with them, a peer support worker, a case manager, to see, what next steps to ensure that they are safe first and foremost. And then just following up with them.
Sarah?
Thank you. Thank you for sharing with us today. This is really great, valuable information. And I just want to make sure that I didn't miss. So I work with CASA Kids, and we have 32 programs under our umbrella. And I'm just wondering, we do a lot with youth drop-in and our Emerge program. What is that age? Like, what is that age that you can receive crisis response services? Is it 14? Is it 18? Is it 22? Like, what is that exact age? And then my second part of my question is, if you would share contact information for your community engagement person so that maybe we could arrange for them to come and speak.
Awesome. Yes. So I'll answer the second question first, just because the community education specialist started on Monday. And so they're still onboarding, and they can absolutely go and speak with you probably in a few weeks. Just that way they can do the onboarding and know more about Lifehouse as well as our services and such. Your first question, my understanding is that 14 years old, we can do crisis, but they do have to have a parent or guardian to sign off or, to be there with them. We, as I mentioned earlier, we are looking into providing services for younger. And that's just it's just been a process. It sounds like it's not something that's really been done, or they haven't just really finalized it through the state. And so we're still working with the state on exactly what they need from us and what training we have to take. But hopefully soon we'll also be able to do even younger than 14.
I have a question.
Thank you. Absolutely.
In listening to the process, either I missed it, which is possible, but at what point are we clearing them medically for comorbid conditions, presenting problems, and so on? And putting somebody in detox is a great thing as a general concept. Depending upon what the underlying circumstances are pathophysiologically, that could be a pretty dangerous move.
Yeah, so it's a medically monitored detox. So we have medical and we have clinical. We also have a director, clinical director. We have a medical director. We just hired a psych nurse. So yeah, we follow all of ASAM, and detox and inpatient also follow CARF. If y'all are not familiar with CARF, it's the certification on residential facilities. So yes, there's an assessment. I think the easiest way is biopsychosocial. I believe we call it just, the assessment, but they get assessed because we may have folks that come in, we're a certain level of care, again, like with ASAM, and we can't provide above that level of care. And so if someone is coming in and they need a higher level of care, our clinical and medical are going to say, they probably do need to go to the emergency room and get stabilized before they're here with us.
Anybody else? We've got like 10 minutes left. Right, being nobody else has got any burning questions, Mara, thank you for presenting.
Thank you.
We do this every month. But the speakers change, so.
Yes, thank you. I appreciate it.
All right, so while, what's her face? Jennifer. What's her face over there? Spins the wheel. Our next, behavioral health meeting is next week, June 16th. It'll be there at Alianza. Our next membership meeting is July 8th. And our board meeting doesn't apply to you. We will be having the bike rodeo planning stakeholder meeting right after this. So if you want to be involved in that discussion, please hang out. It looks like Brian is the winner of the gift card. That'll be done via email.
Do you work with adolescents to train for the bike rodeo meeting?
Maybe you're all interested in the heat-related services that currently going on.
Yes.
We're doing average 20 to 30 patients a day. Client patients. But since we're talking about prices, heat stress puts a lot of people in an aggravated mood. So we had to address 2 crises yesterday. That could be resolved within 20, 30 minutes. But it's because of heat and stress and all that that kind of triggers people. We had 2 serious medical issues we had to address. One patient was stabilized and then transported to the hospital. The other one we could stabilize on the street. So we're out there pretty much 3 to 4 hours a day. During the most intense heat, usually from 12-ish to 4-ish or from 1 to 5, something like that. Always depends a little bit. Interesting is that we are finding a lot of new people. Not cross values, so to speak. Customers, clients we know. There's a lot of people there from LA. There are people from New Jersey. There are people from Albuquerque. We always make a point to ask them where they're from and what they're doing here, why. And a lot of people said, yeah, well, we heard New Mexico takes better care of us. So we came here, which is sort of true if you're from Louisiana or New Jersey. But the fact of the matter remains, we have a lot of people we take care of. I mean, we go through a 50-pack of water every day. Sometimes electrolytes, sometimes basic medical care. But I think it was a great idea to get that program started with the cooling center.
Yeah, just to kind of reiterate, with Mozilla, we do have the cooling center open. It's up to 12 to 8 for dinner. Go in there, turn your phone, get shower, get hydrated. So if anybody does see anybody suffer from heat, you know, it's at 2001 West Fourth at Westminster Church.
And honestly, if you can't remember the Lifehouse number, well, I'm not operating 211 on a 24/7. If we get to the point where we need to, somebody will need to let me know. Right now, I get only maybe 2 calls a week that starts around 2, 3 o'clock in the morning. And I'm not functioning to answer the phone, so I don't, because so far they haven't been crisis calls, to utility help, which I can't do at 2 o'clock in the morning. But yeah, you call 211, we can get you the number if you can't retain the Lifehouse number or Michaela's number or the cooling center number.
maybe one thing I should add to the presentation from Lighthouse. Pecos Valley, as she said, is doing that for a while. Crisis management, we are trained to a point, but we also have a medical license, which is a little bit of a difference. That means we can voluntarily commit people if we have to. Of course, that is really not what we want to, but we can if we did. We also have medication. So we can, for example, especially in regard to the new synthetic fentanyl drugs that are much more potent than regular fentanyl. And with the nasal thing, you probably won't be able to do anything. But we do have Narcan as injectable, so we can you can bag really into it. We also have stuff like epi or whatever, we can take care of patients in the situations. So we most certainly don't want to do crisis management. That's not necessarily what we do. We're medical. But if there's a crisis, if there's a overdose suspected or whatever, we will intervene if we've been asked to, and we can do that to a point what a civilian organization cannot do. So we don't have the power, the experience, whatever, to do it to our crisis counseling. I mean, we spend as much time as we have to, just because sometimes it's the right thing to do to just stay there. But I'm happy about Lighthouse being here, taking that part over. But just want to make sure that people understand if you suspect some medical issues versus injured anyway, we have had that. They fell, whatever. They're being cut. They lost their ear because somebody cut them or whatever. That is a medical issue first. That we are medical first. So that is the situation as it is right now.
Does anybody else have anything that they need to share? We've got 2 minutes left.
They're having their grand opening, so on Saturday at 1:00 at 1 to 5, it's coming out. And they're gonna be collecting used towels for people that need a big shower, so if you guys have questions on it, usually you use the
All the water you drink.
So if you guys have gently used towels, you drop them off like water clock. Or if you want one break, since the others and for some of their.
One more thing, we have been contracted to provide medical services at the UFO Festival. So we're doing I'm juggling a lot of things parallel currently, but I think it's great that Major Roswell trusted us again to provide those services. Last year we had like 3 or 4 patients during the festival, so all in all it was kind of cool thing. So if you want to stop by,
Alright.
if you want to find us, we find you.
Last question is for Sarah, and Sarah will end the meeting.
Okay, I just wanted to share an update really quick. With the weather getting so hot, our Family Resource Center could no longer be at the 500 North Main location. And so they are out in our mobile unit, out in Hagerman, and then actively staffed over on 106 East 5th Street. And so if you have anybody that needs Family Resource Center services, please send them over on 5th Street so that we can serve them until our new location is up. Hopefully, please pray for us in August.
All right, thank you, Sarah. And with that, it is 1 o'clock. Thank you guys for another wonderful membership meeting. Keep Zoom on for those that are staying for the bike rodeo update. Unless you guys all leave.
Oh no, I'm hanging on. If y'all are talking, you're on mute. Are y'all still?
Tiffany, can you hear us?
Yes, I can hear you now.
Okay, so I'm just explaining that Carrie and I went to the arena and was able to look at the outlay. And so we ended up eliminating the bike washing station just due to safety reasons. And so what I am envisioning for the registration station, it will be where everyone will be coming into. We're gonna need more. We're gonna need a lot of cones and barriers from the city, and then also probably some of that yellow tape, caution tape, so we can rope it off to put everybody into the registration station, right? So the registration station will have the sign event waiver. And then we want to register bicycles with the Roswell Police Department. This is where we were discussing maybe the police department have a sticker that coincides with a sticker that will go onto the bicycle itself. And then if a bike is stolen, it's like their own individual serial number. And then we have gone back and forth on bicycle passports and stamp sheets. This is where I really need advice from everybody in the room and online. If we should do this, how should we do this? Is this what will get everybody to and from all of the other stations to get a prize? We entered into a prize, so we know that they did all the stations. The issue is our stations are set up for bicycles, not for, it will be an all wheels event, but the stations are for bicycles. So if someone came on a scooter, are we going to have them still go through how to change a bicycle tire station, which I think is still good for every child to learn. And it's like a STEM type of putting tools in kids' hands type of situation. So I would like to know how you guys feel about that. And then receiving an event map and instructions. So it went back and forth on how we would do this. Would it be everybody comes at us at, registration is from this time to this time, and then there could be groups A, B, and C, and then they rotate to the different places. Or being like Classic Roswell, people come and go. Right. People are not going to come and register on time, and then we'll just have people straggling in. And so where we have like a blow board or a megaphone or some kind of speaker system, then we let them know every 20 minutes a station changes, or every 30 minutes. So you guys think that's better?
Well, yeah,
I mean,
they'll straggle.
right.
Well, and then people will be maps or radios.
Right.
Once they register, it's then they're able.
Right.
Thank you.
Okay. I think I like that better also.
And maybe you might even be able to put it out there as each thing is gonna start times or X, Y.
Okay, on their map.
Yeah, right. So that people come at a specific time. You might get more staggered crowds.
Okay. Great.
What time are you?
I don't want to tell you.
It's from what time to what?
We went with 10 to 1:30. Where am I going? Right, I'll go to safety booth. Oh. Right, thank you. Okay, safety booth will be the next one. So they'll do registration, and then everyone will go directly to safety booth. Because safety booth will be how to proper fit your helmet. The helmet safety education, and then giveaways as available. I have reached out to 2 different manufacturers. I think 888 is going to be our best bet. They told me today, they want to know what our grant amount is or our budget, which I don't prefer to tell them that. I prefer to get the cost. They said we have a bunch of mixed match helmets, colors, and sizes that I can blow out because they're discounted. And then our current line of wholesaling prices half off of retail. So maybe a deeper discount. Can you please let me know a little bit more how much you would have to spend, how many helmets would be ideal? Do you want 100 or exactly 100 or more than 100 or exactly 100? And she'll put together the absolute cheapest possible deal so that will work best for us. Also, do we want different sizes of helmets? And or she can add pads in there as well. I trust this person. I've been working with this person for about 10 years in the roller skating community, and she is the PR for US for helmets and pads. And then I reached out to my own sponsor, but I don't think we can meet her deal. So I still don't know. I saw some cheap helmets, but I think it was a scam for both helmets that were around $7 a helmet. So I'm guessing around $10 a helmet. So it's something that we're going to need to discuss on how many helmets you want to purchase. And then also, if the child does not have a helmet, will the child not be allowed to participate in the races? That's something that we are going to be set on. Because if we only have 100 helmets and 300 kids show up, then they're excluded from all the activity.
Are you asking them to bring helmets with them?
We haven't put out any information yet, but I think that's something like, do we not promote that we're going to be giving out their helmets?
So what if that free helmets are at the end of the event? If you don't have a helmet, you get one bar to be out. And then at the end of the event, whatever's left, then you have free helmets.
And that's what I was hoping, that maybe if the school district gets their grant, the school district is looking at getting a grant that will be like for Strider bikes and bicycles and helmets and trailers, and then it's going to be like a curriculum into the PE program where the bikes can actually be transferred to different schools and like checked out like a library for a certain amount of time, like 2 weeks. They do a bicycle program at their school. Possibly if that they receive that grant, which it looks like 99.9, they're going to get the grant. If they get the material before October, maybe we could use even all of it, even the bikes. Do you think?
Yeah, maybe. I mean, it's gifted to the school district, so the school district would have to be involved.
That would be a Brian Luck question.
Yeah.
So
I don't know that they'd be willing to. I think it'd be better to find a sponsor. Like say if they're $10, he's finding $1,000 sponsor. Find a sponsor that's willing to have those loans, where instead of trying to use that grant, it's really supposed to be so especially if they're brand new thing.
right, I know, because the more someone just walks off, right,
Which can easily happen in such a large
right setting.
Yeah.
Okay.
But I think, telling them maybe to bring their own helmet if you have them. Or I think if you tell them you're gonna get it away.
Yeah, I would probably just say helmet fitting. Come and make sure you got the right size and show up, then we can address those. But yeah, if you do free helmets for everybody, everybody's gonna come.
Can you ask the people from the bike rodeo Las Cruces.
Yeah, I mean, and in fact, the guy that I work with, in Santa Fe wants to be involved. He says it's willing to, he helped with the Las Cruces one and one in Santa Fe this year. So, okay, they're like Fiesta or whatever. And so, we'll put him on next meeting. Okay. And so he can be added in the loop since it's actually done.
Yeah, I would like to understand safety and how to participate if someone shows up to actually care the bike, right? I don't want anyone to feel excluded or left out, but I also. I think we have to just be careful of it, right?
Well, that's a law, right?
Yeah, actually, yeah, it is a law, there is a helmet law.
I think the right to race, like county council, and advertise on fire, of course, and then video apparently to say it's not to participate in the race, so it's not very helpful.
Right. I understand. Yeah, okay. Okay, so then and as part of so then part of that safety booth would be a bike safety talk, so I would need somebody to be willing to discuss the rules of the roads, that has signals, visibility, lighting, and safe street crossing, insurance, and this could also probably. This will be taught more at the starting as well. But we want the registration to count go straight into the farming company. So this might be two different things. This would be the ABC, right? Yes. Bike safety talk. Okay, so then the bike tire repair station. Right. So the goal is that children learn how to fix a flat. So, well, I think what we were thinking with Daniel was that he was going to help people. His station was going to be for people fixing their flat tires right then and there. But I wanted to make it a station that everyone went through, like a 20 to 30 minute session. And that would look like he will be demonstrating on a bicycle how to take it off, and if they want to be using it on their own, like he'll have the tools there. So they'll need to be a tire leveler, a shunt pump, or patch kit, so they'll be able to show on the patch. Or two, we talked about different if we had extra tubes that could be in the fifth, that might be core if that's if you don't want to give out. Which you will need to get us those prices. And then marker for identifying punctures. And then they're teaching how to remove the wheel, remove the tire, locate the punctures, patch, reinstall the tire, and inflate it properly. And then on to the next station would be the minor repair station. The goal is to teach basic maintenance, how to tighten the handlebars, adjust teeth, pipe, lubricating the chain, brake inspection, checking wheels, quickly release, and then installing reflectors. Which I didn't even realize there's all this to a bicycle. Yeah. I mean, you do just take it for granted. You do, and then we end up with rusty chain, and then we're like, we're not going to use spike anymore. So it's really teaching all of this and maintaining the bike as well. So tools, this is something that I'll need from Daniel also if I'm missing anything or anything else so we can for his station. And then the activities that we will have is there will be a large area to the east. So the east side of the DeBurn parking lot will be used for free space, practicing, and open riding area. We'll have a solemn cone parade, and then these will be parallel to each other. So there'll be a cone race in and out, and then a race the radar. And then we would need law enforcement to come out And then we need, some volunteers, their timing, that could be put on their, their. Pass that. Then the obstacle course, navigating turn, hazard and skill challenges, I would like to see if maybe a youth would want to design this, or I don't, I would like some youth to be involved in some form or fashion. I don't know if maybe, talk to Tamara, maybe someone from 4-H could like come up with, this is as much space as you have, like what are some obstacles that, like rocks. um, some type of bump or a ramp, right? Yes, that they can make an obstacle course. So that comes in there.
I mean, just so with your stations, you have what, 5 stations?
If you keep go up on the culture station, we're gonna have. No, the other way. Yeah, so we're gonna have the registration station. Helmet fitting, the ABC, tire repair, minor repair. Riding horses, so the riding horses will be your solemn. Your raise the radar.
So what are you requiring them to attend with us? Their count.
The helmet safety, the ABCs check. And that's what I was wondering, should we have them go to the tire repair, minor repair?
The only thing I'm thinking is if you say tire repair is gonna be like 20 or 30 minutes, you're gonna lose people. That's gonna be way too long for those kids. So if everything is like 10 minutes at each. Okay, but I just know.
I don't know.
Any of my kids are gonna be like, oh, done. And you're gonna lose.
I don't know how long it takes for tire repair.
Well, I mean, he doesn't have to go through the actual whole repair. I mean, he could have a couple of different bikes in different stages of the repair, out there. But I'm just saying, if those things don't go last 10 minutes or less, they're all gonna be like, all.
My guess is if you go having, you require things like the helmet fitting and the ABC check, and then they're all gonna want to go to the right.
Yeah.
Exactly.
I mean, and not that those other things shouldn't be there, because I think those are important things to know for a parent. Mostly, more than the
Well, little older kids will be fine too,
right?
But I just think.
Well, you can also rotate through the meaning that everybody can't go to the writing course because.
Right, at
there'd
the
be
same time.
200 kids on the
Right,
writing
right.
course, so there's so many on the writing course, but so many kind of go over to bike repair.
Right.
Before they go, so they can flip flop those things.
maybe not have to go in the corner.
What if those two are interchangeable, like you have to do one, but
Then you
get one or the other? Yeah, that way you don't have to sit for 20 minutes, so each of those, you just do one of them.
You do the tire repair or bike repair.
Right.
Like not the other ones be mandatory, but say, as a third, you need to do a week of the tire repair or the.
Yeah, because that's if you want, right, and then if you're busy because you want to go to the solemn course and you want to go to radar, but those two are back, then you can do something else.
Right.
As
Well, what I was thinking is like the timing of the whole thing. So if you have 3 or 4 places, say 4 places, you want them all to go, and you anticipate they're all gonna be 10 minutes apiece or so. Then you could start a new thing every.
The course is
45
gonna
minutes.
take less than a minute.
Right, but I'm just saying, you get them all through this round, and then all those people go to the courses, and then you start a new round over here, and all those people go through the courses.
That's what I was wondering about this.
So that's why I'm saying every 40 minutes, 45 minutes, you start a new.
Cool.
Right,
That's not like case of it.
right, and that way you tell people we're starting at 9, the next one will be at 9:45, the next one will be at 10:30, right, and that way. You don't have everybody coming at one time. It's gonna be a lot more, spread out. You don't have people waiting.
Kind of like that, but do it, so we're starting at 10.
Well, whatever time it is, but
So do one at 10, do one at 11, do one at 12.
yeah.
And then if it takes 45 minutes, it gives you 15 minutes to kind of
Reset.
pee.
Yeah. So you basically have 3 heats.
Yeah.
Right, so then will we need a registration, they each get one different color,
Wristband,
yeah.
Yeah.
what I'm thinking, because that's your heat. And that way you know. all the
And
rest.
the 5 stations, they could start at any one of them and you just rotate them through. So you split them up, so if there's 50 kids, you put 10 kids at each station and they just rotate the whole thing through for that 45 minutes or whatever. And
Right, they might not start at how much did it, they might start, yeah,
Yeah.
at something else, yeah.
You guys like that?
Makes it for management,
Yeah, because the 200 kids all at one time is just kind of,
like Charlie Foxtrot is what I.
Well, I don't, and that's the thing, how are we going to know when people are coming, they're just gonna,
Well, you just say that you have how many slots, I mean, for the.
Okay.
for-
An event, right?
We're gonna do 50 slots, heat 1, 50 slots, heat 2.
Register.
And once that's filled, then you say, great, I'll see you in an hour.
And then if you have open slots, then walk-ups can come in, but if not, then you don't.
It's a better idea.
or you have that conversation with that guy that did the Santa Fe and
Right.
Christmas one,
Yeah.
figure out how he did it,
okay,
and then take the,
The best of whatever,
yeah.
right?
I like the idea of the recording.
I love Eventbrite. She has become my best friend.
Well, then starting to teach Russell how to like actually register.
Yeah, and that will knock out their liability for.
Oh,
Yeah,
that's
you
true.
can put it on there and get all their contact information on a spreadsheet.
So you wouldn't have that.
And so that when they come up, all you gotta do is check them off and hand them back.
Except for your walk-ups,
That's right.
it's also on it.
Well, and if the things aren't full, then, great. I like it.
So then how many, are we gonna give away helmets or are we just gonna get one?
I'm trying to find out if I have any. I may not know right this minute, but Robert's asking if we could do some trauma funds for.
I'm texting Debbie with early college and Cassie Carpenter with early college FFA to see if we can get some volunteers, teenage volunteers for that day.
Okay. So our potential, or our community partners we have so far is our Travis County Health Council, our Children Kids, Travis County, Moon Rock Bike, 4-H. They said they are gonna try to see if they have any. So. Because
of the extension office, yeah.
Roswell Independent School District, which Charlie and doing family issues this summer, or Big Brother Big Sisters, Roswell Parks and Recreational Department. Other potential partners. Local healthcare providers and hospitals, local cycling clubs, Roswell Police Department, Travis County Sheriff's Department, DOT, well, they are. Now, we were talking about food. Do we want there to be? I have the list of food trucks that went out for the soccer fields, for all those food trucks. Or Carrie and I were talking about possibly getting the sheriff's department out to do the burgers and hot dogs. How does that work? They have their own grills?
I think so.
And then do they get the?
I don't know that for sure.
Well, they have a discretionary fund too, so that might be a good ask for them
Okay,
to see if they can provide that.
And a lot of times they'll go to Sam's and say, hey, I need
Yes.
this, right, and so then they'll donate it.
Yeah, let them handle that side of it, because they know what they need.
I would do that.
Yeah,
I think it's good to have as much law enforcement officers.
But then you also have to remember, if we're doing 3 heats, you're gonna have to do food at 3 different times.
Well, the first food could start at 11 because they're not gonna be
Balance
done.
finishing.
Yeah, and so it could just go 11 1.
Yeah. Something to keep in your mind as you're going.
Right. Okay, this part. Sheriff's Department, does anyone have contact? Do you have contact? Okay. Where sheriff's Department? Yeah, and then I'll touch try to see what going on. What day is it? October. Good, start. What things do we need if we get funded? So public giveaway costs, we're thinking around $10 a helmet, so 1,000 to 1,500, I think should be around 1,500. Spare back tubes and repairs, is that something that we really wanted this?
Or giving away.
Yeah, for those that come with their bike is flat.
Single bike is a different too, so how are you going to assess that?
I got all the,
Now, patch kits might be a thing,
okay.
so that might not be a bad thing to have some like emergency first aid.
Patch kits makes way more sense than tax.
And,
Oh, that green slime too stuff.
oh, that stuff is, please don't ever mention that word.
You don't like it?
I love the concept.
Should have. I mean, I didn't.
Did it get all over you?
It got all over everything.
And it caused the whole thing. I've seen that.
Oh, on two, yeah,
I do that to all my kids too, so
I know.
it works.
That's why I take it.
Like the fix it flat.
Yeah,
Yeah.
yeah.
I-
Put it in there when we first
That's
get.
where I take it to the rock because they've got the real, they know.
They have like a pump that's like.
I got a whole machine. I can't do any of that stuff without causing a natural disaster in the backyard, so.
That's something personal probably.
It is, there's a lot of my personal, I'm gonna call 988.
You will.
Probably get one, buddy.
This 24/7 line.
999-444-777-2222. That was the number, I think. I could have. I'll call 211.
211 will tell us if it's not 3 in the morning.
Okay, so yeah, because we're having snacks, yeah, fruit, and if we have funding for that, for sure, we're gonna need water. Not sure if we wanna do a volunteer shirts. I think if we can pull off some sponsors, it would be nice to have all of our partnership. And so we are also recognizable to parents and questions.
It's all that is kind of safety that's.
Oh,
That could be a
Full safety vest with stripes.
What's the purple?
I'm all over yellow. RESC might be able to do like a
radioactive site.
snack like that. You like this snack for something families, like,
Okay.
you know, where they just provide something.
If you're doing
They
it
kind of
safe.
have cheap chemicals that it's a little sure. I do currently.
Get for screens not involved.
Okay. And we, you know, I have them as a partner. With the RASD, yeah, let them know, let her know, what, yeah. It's hard to catch, she's hard. Yes. It's not mine. Then who would be the cost on the printing, the passports, waivers, maps, secretary? No, oh, it's very hard.
Is it Emily Dee or different now?
She's great at her.
This kid,
EVRENDOM.
or should the ring up. Who does, what's the service, what services? Head of the kitchen.
Abdul.
Count?
Oh, you talking?
Is as an RSD director. I think the one I'm talking about went over to Dexter.
Shelley.
Oh, that's Shelley.
Shelley, so.
What about Shelley?
Trying to remember which one I'm related to.
Oh my gosh.
Okay, never mind.
We can't help you.
And then insurance or the event permit. So I'm working on the permit with the city. I've already submitted it, but I haven't heard back from them yet.
None of us heard anything about it. And I said, hi, hey.
Well, it's,
Following up.
but you know somebody in the city that really wants this, so you can talk to Mr. Morris.
Yes.
So,
Do you know the cost of what the insurance will be?
It's usually about $1,000.
So,
Yeah.
with just helmets and insurance, 25.
Hopefully I can get it cheaper since I've got to get 3 events. So you talk about the boat truck.
I don't even, he's very sure of that stuff, but then, so.
They said that it was going all these swift before June 30th, and I'm like, that's really quick. Right? So, and I haven't heard back from her, so I will put some money.
Yeah, they just didn't know.
So I have you, this thing sounds nice, so I try to understand additional, sure.
If they're gonna.
That's about $1,000.
Right, and there is cost, you know,
Stop it, it's not a child.
there's
Still some of that.
because
I was wondering if I know.
See, it's.
I know.
I just always for the cast, a lot of order.
Yeah.
Still everything.
Okay, so you will reach out to
That's the
Tim
truth.
and the gentleman.
And Gabriel said that gonna meet. Yeah. She has to be on the.
Yes.
We'll be with some. So he would be on.
Yeah. Yeah,
Right. Yeah, I'll make sure. So, oh my gosh, I know. And then I'll, if I have that, I'll have that. Once I'll send twice and then. But there's stuff on there that, sometimes you need to see it from a PR perspective, but. On what I'm gonna go, like, that's just right. And it's.
So that is better.
Basic.
Lives to say it.
Not to, yeah, I really don't know, and I don't care, but, and if it's not here, then I give it, right about, city's right here. A little,
Bicycle racing, that's.
Rob's calling.
Calling you?
Yeah.
I already got the text message.
So it'll be a secret to me.
You weren't included, Dan.
Oh, I'll text Dan.
And then, so let's just make it safe with, we need a goal of 4,000. Here's a 4,000. For now, be sure it's a.
you're saying maybe the kids. So,
Yeah,
oh, no, just the volunteer.
but it's 4,000 for 200 for cost of that. I don't, well then 3,000.
Well, I'm hoping that covers helmets and insurance.
Yeah,
That's not anything.
that's not anything else.
So you better see for it. And I might be able to knock off the insurance, because the health council needs to have the insurance for the expo.
Right.
Which means that if I can
Stand out.
do a year policy and individual riders without having to pay extra costs, then there's no fee for the bike. And there'll be no fee for the stand down. Well, the health expo will be the one who incorporates a lot of that. Because we've already got the funding there to cover it.
One of our gift cards, one of little rights. Are we gonna do anything other than a permanent giveaway? Anything else? Patch kids? Or we're gonna do the little license plate bikes?
Oh, you mean those
Or what?
blank ones you put your letters on?
Designer. We can have another. Designer. Before I choose that.
What do they give away at these
Any question?
find out?
Okay.
Yeah. Yeah. Because maybe it's not a whole lot of giveaway.
Water.
Water to,
I have a crap ton of water. 20,000.
can you just stop writing everybody to come shit? They leave with a good time.
Yeah, they got the race.
Oh. Prizes for that.
For the heat, 4,000.
If I need some of the helmets. That's out of a different.
Well, and if, I mean, if you just want to give away stupid shit, talk to like DOH and see if they have budget for like stress balls or some.
I don't want to give away that.
Yeah, that's right. But I see what you're saying. No, I think you're right. It's like, if you can get helmets, great, water, great, food, great. And it's a good time. And a prize if you win the heat, the fastest, whatever.
Snow cone.
You get the snowy people out.
Free snow cone. 56. 52. Bitty, bitty, bitty. Extension pass. Slush. Sometimes. I'm really fine. I can talk to it. Okay. For.
I have no idea how to manage everything.
No, she's doing weekly classes or having some local working, and it's great. Yeah. Okay, all right, I actually have to go back to work. Hey. Yeah, any other ideas?
We got a question from a few, give it a sec.
Should make it close to small businesses versus.
Oh, we had been look at it. Any with cars, read my comments.
Right.
What I need to. But Anna and I were talking. So she were Riga Valley helping team service. Which are several volunteer EMS team. And so they have, they basically do free medical services.
Yeah.
She can do tax write-offs, so that she basically should have their straight outreach almost.
So,
And
I
she mentioned to me about.
maybe go with the visual.
I came out of the hospital.
Be some fires.
And
They
doctor prescribed.
email out
Injectable.
and then we are talking, right, to people, so
Still,
it'd be like,
she's like, I don't like to do this.
shit, it's coming up, right? We'd like for you guys to be part of it.
I'll just give it to you.
Okay.
And so she.
No,
See if the doctor would give
just
her
more guy.
finish her, then she would.
And
And there was no doctor.
I was gonna
I don't
talk.
understand.
Well, and the.
Right.
Sometimes you do this.
That's why I don't, I know it's just gonna.
Oh, yeah.
But one of the things she was asking me, she said, think there may be a way for somebody at the hospital. Even if it is all they want, or however it works there,
Tom, Jenny.
in these kind of things, like if there was doctors saying, we're gonna release somebody from that's.
No, he's.
Yeah, like you would
Yeah.
be. The protocol would be this, and then she could follow that protocol,
Okay.
because she could look at the medicine for the person.
Plan.
Even
Right.
to 10. And so it was a medicine,
Okay.
you know, and so she could also administer it, but she can't do it without a doctor's order, because her medical license does not. She can push 20 things
Tom.
from the rig, so, but she's like. this is-
And I mean, honestly, I've never heard of it, so I, maybe Warren Harris don't know.
Yeah, that's why I was
If
like,
he's all under control.
so if there's,
Like.
is there a way to maybe.
Objections.
Yeah.
Yes, I know he's super busy.
But even not, be just.
Like they just have to.
That's what about.
And then she.
Such get as far as.
So basically.
Those would be better options.
Exactly, that's why it's like.
Yeah.
Well,
yes. So, we can push it right now, because that just kind of like.
Yeah, so you can just send it, you wanna send us an email, and then we can hash it out.
I will try to.
Yeah.
I just want
Oh, my goodness, like, is she talking?
We are.
Yeah, it's,
That would be good.
there's a lot of it, because
They have a vet director or house.
the state EMS doctor is.
That's, yeah.
Yeah, I think we're done. Bye, Tiffany. See you tonight, maybe. Oh, no, you're gone.
But yeah, that's, she's got a medical